Hi, so my project for anatomy was asthma. So, asthma is a lifelong chronic inflammatory disease of the lungs. It is not biased to any age and it can affect any individual. Asthma originates from the Greek meaning short of breath. In the 19th century, Dr. Henry Hyde Salter redefined it as a paroxysmal dyspnea of peculiar character with intervals of healthy respiration between attacks. This description is more centered towards the airways of the human body being narrow due to the contraction of smooth muscle. In the later 19th century, between 1970s and 1980s, asthma gained more of a clear definition and understanding. This is when asthma really evolved and became more defined, controlled, and easier to treat. Today, asthma is related to the respiratory system and is characterized by a chronic airway inflammation. So starting with asthma triggers. So an asthma trigger is something that can aggravate and activate asthma symptoms or an asthma attack. There is two types of triggers, intrinsic versus extrinsic. So the difference is an intrinsic is something that's within your body that is triggering your asthma symptoms or attack. And something extrinsic would be something outside of your body causing the asthma attack or symptoms. Some asthma triggers would be stress. So stress is an example of an intrinsic trigger. It is something within your body causing that asthma attack. There's smoking. It doesn't matter directly or indirectly. You could be in a room full of people smoking and that will still trigger your asthma. There is cold and flu, there's exercise and allergens, so allergens such as dust mites, pollen, anything in the air that you could be allergic to, your pets, just things like that. So some symptoms of asthma, your symptoms can be mild, moderate, or severe. They are shortness of breath, coughing, wheezing, rapid breathing, chest pain, tightness of the chest area. With these symptoms, the more aggressive they are, the harder it is to control. So it is worse if your symptoms are more severe versus mild. The pathophysiology of asthma. So how asthma works is it's a disease of inflammation. The inflammation happens in the bronchial tubes, also known as your airways. Asthmatic people, their airways are always inflamed. So it doesn't matter if you are having an asthma attack or if you're having symptoms or if you're sleeping, breathing normally, eating, breathing normally. It doesn't matter. Your airways will always be inflamed compared to a person that doesn't have asthma. Your airways are swollen and filled with excessive mucus, and that means there's less room for air to pass through. A contributing factor to this would be airway hyperresponsiveness. So once you come into contact with an asthma trigger, say you breathe in a dust mite, this asthma trigger causes a reaction in your airways. After being introduced to the trigger, their airways begin to swell up more than they already are. The muscles begin to squeeze and symptoms such as wheezing start to occur, and that's when trouble breathing starts to set in. Moving on to excessive bronchoconstriction, which is another contributing factor. Airways are made up of hollow tubes with layers of tissue, and this includes a layer of smooth muscle. So after the airways respond from the trigger, the muscles begin to contract, which squeezes the airways. These contractions are too hard and they last too long, so this intensifies the difficulty of breathing to where it can be pretty much impossible to breathe. And this is pretty severe. So overall, mucus-filled airways along with contractions can block the airways and make it difficult for air to flow through these airways of an asthmatic person. The treatment to asthma. So there's no cure, but the treatment is with a goal to control your symptoms and your attacks. There's two types of treatments. One is long-term medication, which helps lessen the airway inflammation and prevents symptoms. And there is a quick relief medication, which is also sometimes called a rescue medication, and these relieve symptoms during a flare-up. So long-term medication long-term control medications. There is one preferred medication, and that's an inhaled corticosteroid. Therefore, it's prescribed at a low dose, and if your symptoms worsen, they are moved up to a higher dose. This medication is taken daily. There are side effects, so you can get a mouth infection called thrush, and this is when the medication lands directly onto your tongue or the back of your throat. This can be prevented with just a chamber attached to your inhaler. Another side effect would be that it can affect growth rates in children. Doctors have agreed, though, that preventing asthma attack with this inhaled corticosteroid outweighs the risk of the side effects, so this medication is still used. Some other long-term medications would be a pill or liquid form of corticosteroid, an anti-inflammatory medication, immunomodulators, an inhaled long beta agonist, a leukotriene modifier, and a theophylline. Some quick relief medications a quick relief medication, aka rescue medication. The preferred one would be an inhaled short-acting beta agonist. This acts quickly to relax the contracted smooth muscle around the airways during a flare-up. Every individual needs to have a quick relief medication. So even if you have a long-term medication, you still need to have a quick relief medication on hand just in case there is a severe flare-up, and this is just a more aggressive way of treating it. It should be taken within the first signs of the asthma symptoms once they start to appear. It does not ease inflammation, and this medication should not replace long-term medication. Therefore, it should not be taken more than 2 times a week. So if someone is taking it more than 2 times a week, they might want to consult with their doctor on getting on a long-term medication also. Some statistics and prevalence of asthma. Approximately 235 million people live with asthma, and 24 million of those people are in the United States. They are lower to middle income countries account for 80% of asthma-related deaths. There is $56 billion for medical treatments due to asthma in 2018, $2.1 billion for premature deaths related to asthma in 2009, and $3.8 billion for missed work days or school days related to asthma in 2009. There's an increased prevalence of asthma, 7.7% in adults, 9.6% for children, and 17% for African American non-Hispanic children from 2001 to 2009. So asthma is more common in children, African Americans, women, the Northeast and Midwest, and low-income populations. Every day in America, 40,000 people miss school or work due to asthma. 30,000 people have an asthma attack, 5,000 people visit the emergency room due to asthma, 1,100 people are admitted to the hospital for asthma, and 11 people die from asthma, adding up to approximately 4,000 deaths a year. Asthma death rates have increased by 50% since the 1980s. So moving on to the impact of our community, this also ties into the prevalence. So with the rising prevalence, asthma is the 4th leading cause for adults missing work, and asthma is the number 1 cause for students missing school, and this is a huge impact on our community for the financial side and also just for these individuals losing days. The community also must maintain asthma education, so there is something called an asthma action plan that your healthcare provider has to provide for you, and it's how to observe your symptoms, when to modify medication, how to recognize and prevent coming into contact with triggers, how to distinguish severe asthma symptoms, and when and how to take action during an emergency with your actions. There also is an impact on the nursing community, so the nurse impact, we would have the responsibility to promote health for asthmatic individuals and patients, and we also have the responsibility to provide health educations for asthmatic individuals. To do so, we must continue our education, be able to target specific patients and their specific symptoms who have asthma, and we also need to become sensitive to asthmatic patients. So overall, viewing asthma as a whole connected through its history, cause, symptoms, pathophysiology, treatments, prevalence, and its impact on our community, this will all help us identify, prevent, treat, and control the disease. So as asthma continues to be an issue in our population, it is essential for us to understand how to identify it, prevent it, treat it, and control the disease. And that's it. Thank you.